So thank you so much for joining me in signing this resolution. Seattle becomes the first city in the nation to pass a resolution in support of the Medicare for All Act. And we're really excited about being the first. We like to be the first. Seattle prides itself on being the first, and this is certainly no exception to that. Access to quality, affordable health care should be a right, not a privilege for those few who can afford it. After years of Republican congressional leadership obstruction and undermining of the Affordable Care Act, it is clear our country desperately needs a new, bold, and innovative answer to the many problems plaguing our failing for-profit healthcare system. No country in the developed world has the sheer number and depth of problems that Americans confront within our healthcare system. Exorbitant insurance premiums and deductibles, outrageous prescription drug prices, underfunded hospitals, and poor health outcomes, all felt most deeply by our lower income communities, our middle class, and people of color. That is why, with this resolution, the City of Seattle sends a clear message to the other Washington that it is time for Medicare for all. Here in Seattle, there is strong support for Medicare for all, and I know many Seattleites will join me in eagerly supporting our Congresswoman Pramila Jayapal and her 100-plus co-sponsors in the U.S. House of Representatives who have introduced the Medicare for All Act of 2019 in late February. I want to say thank you to Congresswoman Jayapal for her leadership on this critical issue. And unfortunately, she couldn't be with us today, but she is represented in the room today by her district director, Rachel Berkson. Thank you for being with us today and for your work on this issue as well. I'm also grateful for the many individuals and organizations that have been fighting tirelessly for single-payer health care, in some cases for literally decades. David Loud from PASARA, Bevan McLeod, Alliance for a Healthy Washington, Sadiqa Sakin, president of the NAACP, Seattle-King County, Margaret Carey, MLK King County Working Families Party in Seattle Indivisible, Kelly Powers, VP of Health Care for All in Washington, to name a few of the people in our community who have been fighting really, really hard to make this a reality. It is simply unacceptable that our country, the wealthiest and most industrious nation in the world, has such an abysmal healthcare system. Here at home, as of January 2016, 13% of Seattleites ages 18 to 64 are uninsured. 28% of Seattleites did not have a dental visit in 2015. 26.5% of Seattleites live at below 200% of the federal poverty line. And 46.9% of Seattleites pay 30% or more of their household income on rent. They are deeply cost burdened. In a city like Seattle, which is experiencing a massive housing affordability crisis, make no mistake that there is a relationship between health and housing. In King County, adults in high poverty neighborhoods are 7 times more likely to be uninsured than adults in low poverty neighborhoods. This is true even after implementation of the Affordable Care Act. In King County, adults in lower income tiers are 8 times more likely to have unmet medical needs because of health care costs than adults with higher incomes. In our regional public health authority, which includes residents of the Seattle Housing Authority and the King County Housing Authority, 83% of those residents qualify for state-based Medicaid. Residents of the Public Health Authority represent 11% of our Medicaid population within King County. These numbers make it very clear to me and to all of Seattle and the Seattle City Council and Mayor Durkin that our country deserves Medicare for all now. And I urge all Seattleites and Americans across the country to call their congressional representatives to say yes for Medicare for all now. Thank you.